information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing.
Hey everybody, welcome to Ageless Health Livestream with yours truly, Dr. Tom Roselle. Listen, I got an interesting process I'm going to take you through today. I want you to understand how things really show up in the body, and sometimes, we as patients miss them, but doctors also miss them. And we're talking about something that is so common relative to its presentation, and that's shoulder discomfort and pain. People start grabbing their shoulders and it hurts and they can't lift them beyond here, and it's difficult getting to the back and so forth. But I want to go through one specific process relative to ruling shoulder pain out and its differential pieces that could be much more serious. What I'm talking about is this: shoulder pain can be a result of the beginning stages of heart disease. And what we miss sometimes can cost us, and that cost can be our lives. So when we see a patient that comes into the office, we have to take multiple pieces of the puzzle and put them together, very much like a hand and glove presentation, right? So the hand hurts, but there's things that are overlying it, they're covering it up, and it really doesn't make sense. It's the same thing with any part of the body. The shoulder primarily, we have all these muscles that attach to the shoulders that allow it to work, and we can raise our arms, we can move it around. Professional athletes and amateur athletes, and I call athletes in our own home because we're doing all kinds of things. We're vacuuming, we're sweeping, we're bending, we're fixing, we're doing laundry, and we have to use our arms and shoulders. We have to do them in a very specific way. But all of a sudden, that shoulder starts hurting, and we can't figure out why it's bothering us. And we didn't do anything. And, it's been good up until now. We haven't changed our lifestyle. And we even get a little bit of exercise. We're walking, we do a little bit of stretching and so forth. We're not that, overweight. What happened? What is going on? So I want you to understand these keynotes that might get your attention very differently, and you really need to report them to your doctor. Very recently, I read an article that said, integrative natural healthcare practitioners are generally much more effective at picking things up. And the reason for it is that we don't put your symptoms into a computer, push a button, say, here, take this pill. We're trying to find out what the intimacy is of one system leading to another that may be causing something not to work properly. Okay, so I know that's a whole lot of stuff that may be confusing to many of you, but let's just kind of break it down. So you have a shoulder, right? And you have muscles in the shoulder. You have an anterior deltoid muscle. You have a middle deltoid muscle. You have pectoralis muscles that come like this. You have a muscle underneath your collarbone. It's called the subclavius because this is called the clavicle. And then you have another part of that breast muscle coming across like this. And all these muscles help stabilize, but you got muscles in the back too. You have muscles called rhomboid muscles that hold the shoulder blades kind of together towards the spine. You have, if you watch the weightlifters and they go like this, right? Inside of here, you see these little finger-like projections. That muscle is called the serratus anterior. And it starts underneath the shoulder blade, and it holds the shoulder blade flat against the back of the chest wall. Now, you have another one that's underneath that shoulder blade, and it's called the subscapularis muscle. And that's a really important muscle because in my world, in applied kinesiology, what we look for is the relationships between muscles and organ systems. And muscle and organ has a common nerve root. It has what? It has a common energetic point in the acupuncture system. It has a common blood supply. It has a common lymphatic drainage system and so forth. So when we look at something, we have to start picking it apart. We have to look at, is that shoulder pain related to something other than just a strain or a positional problem? Is there something else going on? So I want to give you some clues that are going to be useful. And by the way, on the 19th of March here at the Roselle Center for Healing in Fairfax, Virginia, Dr. Jerry Coward and I are going to be sharing the stage. And we're going to walk you through shoulder problems, but their origins, but more importantly, what you can do about it, whether you got a frozen shoulder, whether you have a strain, whether you're overdoing it on the tennis court or the golf, in playing golf and so forth. Something needs to be fixed and not just put it up with. It's not just take these, whatever it is, Advil or Motrin or any of the NSAIDs. And because what happens is they block the repair process. They drop the inflammation down, but they block the repair process. And if the muscle's not working and you're not repairing it, you may not feel the discomfort, but it's going to get progressively worse, leading into something called degenerative osteoarthritis. Not a good thing, right? So we want to make sure that you don't get to that place, but you know what to do with it before you get there. So let's talk through the puzzle. Let's see what we really can do as far as making things very succinct for you, right? In this case, we're going to talk about the heart, and we're going to talk about the shoulder and the intimacy between the two of those. And so when we're talking about heart and shoulder, we have to make sure that we understand that we're talking about the neurological muscle connection to that organ system. Remember what I just said, the neurological muscle connection to that organ system. And the guys that really get this, that they understand it, are people in the world of applied kinesiology. And that's my bag. That's my world. That's what we've been in for, over 4 decades. And we want to make sure that when you have a problem, it's not a prodromal, a warning sign that says that you've got something else going on and it's being ignored because it can be subtle. Okay, so first let's talk about that thing called your heart, that's about the size of your fist sitting right here in the middle of your chest. And what really occurs when it begins to have a problem. And unfortunately, in today's world, we're seeing a lot of that. We're seeing a lot of different heart problems. And, we won't go into the why because, a lot of social media sites don't like to, stand up, if you will, and face up to what's really causing some of these things. Now, here's the deal. Your heart sits here and it has nerves that go to it. And those same nerves go to certain muscles. And the one muscle that we're talking about is called the subscapularis muscle. Okay. Sub means underneath, scapula means shoulder blade. Okay. So this muscle is underneath your shoulder blade. And what it does, it helps you, if you will, push backwards. If your hand's like this, you're going to push back like this, just this motion on either side. And what we're seeing is often there's a restriction there, or there's pain when we do it. So we stop doing it. We don't irritate it because nobody wants to be in pain, right? So when that's the case, we kind of dumb it down, or we go take something that kills the pain or drops the inflammatory reaction and so forth. But at the same time, we should be paying attention to other signs and signals that may be indicating that something's much more significant and more severe relative to this pain that we have in our shoulder, and more predominantly on the left side. Okay. And it can be the right, but on the left side. So why is this subtle, slow process taking place? Well, it can be because the heart's not getting the nutrition that it needs to get. That's something. It could be coenzyme Q10, could be magnesium, could be potassium. You could be, oh my gosh, I need to take a lot of potassium. Did you know if your potassium level is way, way, way too high, that your heart will go into tetany? It can't fire because it's a muscle that's, just like locked down tight. Remember, the heart's a muscle. If there's not enough potassium in the body, then the heart becomes like this. It can't contract. It's just kind of flipping around, without any tone to it. So either way is too much. And sometimes, what's the sweet spot? Where is it? Well, on a blood test, just so you heard it, you want to have that potassium level above 4, even though the laboratory levels go to 3.5. So here's the situation. Potassium is also used in fight-flight reactions, stress patterns. So in the morning, you go get your blood work done, and it's the beginning of the day. You're not really that jacked up. You're not really that tired. And it comes back at 3.6, 3.7, maybe 3.5. Well, the laboratory ranges are 3.5 to about 5.3, 5.4. Now, your doc says, okay, you're there a little low, but it's okay, nothing to worry about. Now you go into a stress pattern. And what happens is that your body's going to steal that potassium to keep you into that aggressive fight, flight, sympathetic platform. Now what happens is that you start feeling your heart flipping. It's flipping around. It's not working the way it's supposed to. But your potassium was good, right? The solution at that point is taking more potassium. But make sure you're taking the right kind. Now, here's the other piece. Let's go to the other extreme. Your potassium level gets too high. It's about 5.6, 5.7. Now you feel this tightness in your chest. And it's, it feels like, why is that? It could be, a thump or a lump or a bump that's going on inside your chest. That can be a result of potassium. Okay, now I'll give you a couple things. Magnesium is another one and so forth. But I wanted to show you how, even though that things look the way they're supposed to, maybe not the way they really are. Okay, let's go back to the neurological connections of that heart and the shoulder. Okay, so these muscles all have to have neurological stimulation. Where do they come from? Well, they come from the lower part of the neck. And I'm sorry, in the upper part of the back. So if that's the case, if those nerves are being irritated because the housing, the bones of your spine are out of position in a way that it causes the nerves to either be pressed upon or overstretched, or the cord, the big coaxial cable that's coming from your brain all the way down, the cord is irritated and there's pressure or there's a stretch factor on it. That all by itself can cause the signaling to this organ and to the muscle not to work the way it's supposed to work. So now you have this aberration, if you will, between the two. And it's coming not from the heart. It's not coming from the shoulder initially. You didn't hurt the shoulder. You didn't do anything foolishly, to set your heart up. But the nerves that go to it are not working. And they all come from this area right in through here. So, those of you it's sore, you took an x-ray because you had a sore neck. And the doc says, well, you got a little bit of arthritis. But medically, they miss the point that these nerves can be irritated because of the disrelationship of the neck. When that happens, you have, in my world, it's called a spinal subluxation, meaning a small dislocation, millimetric, that's all it takes, in a way that the mechanics of the spine are not working. So subsequently, those nerves are going to affect the organ of the muscle. For the heart, they're called splanchnic nerves. And you have the same nerves, the same branches going to the muscle as well. So that subscapularis muscle now is not going to work. And you start getting this ache, or it's difficult for you to reach backwards. And it's just much more, you don't have the power to do it. And pretty soon the shoulder is dull, it's aching. So by the way, I want to show you, if I can get this up on the screen, of where this is your neck, by the way. So kind of an interesting place, right? And in the neck, you have an artery that goes all the way through. This is the top where your head's going to be. This is the bottom. This is the back of your spine right in through here. And the nerves that come out in the lower portion are the ones that we're talking about. And then they go to the muscles and they reflex to the heart as well. So you have to understand this. One of these days we're going to get this program so I can put up all kinds of things for you, and then you can see it. I can finger point. I can really teach you. But on the 19th, join us at the Roselle Center for Healing in Fairfax with myself and Dr. Cowart, and we're going to go through this. I'm going to actually demonstrate. I'm going to show you what happens. So if you have shoulder pain, hasn't gone away, you've had shoulder pain, and nobody seems to be able to figure out where it's coming from, even though you've had really good rehab, you've done other things. There might be a missing link here, and we have to figure out what that missing link is to be able to resolve and fix the problem. Okay, so join us and make sure. And how you do that is really simple. You go to drtomroselle.com. and register there. You can do it the old-fashioned way. Call the office, 703-698-7117, 703-698-7117. Register, and we'll have fun, as we always do, and we'll show you how these things work together back and forth and get it done. But remember, the shoulder has multiple muscles, and one of the muscles relates to the heart. Now, in every case of shoulder pain and dull ache situation, is that a heart problem? No, it's not. It's not. But there are certain signs and characteristics that you have to pay attention to. So what else would I look at? Well, your patient, you come in and say, hey, listen, what medications are you taking? And then all of a sudden you're on a statin, or you're on a blood thinner, Eliquis, you're on different types of things, and say, hey, are you a heart patient, or is this preventative, or what's going on? See, even these things that you're taking preventatively can ultimately cause damage to the heart, because they steal coenzyme Q10 from the mitochondria, the little engines within the heart, and that's a problem all by itself. We could go back and forth on the necessity of a statin, and there's literature across the board that says, as you get older, statins are really not the way to go, and cholesterol levels are necessary for brain function and hormonal function and neurological integrity and so forth. And if you start breaking that down, you drop that cholesterol way too low, you're going to feel like hell. So there's a whole debate. You go into PubMed, you go to New England Journal of Medicine, you start looking at the different studies that are out there, and try to set aside that there's other positions and other pictures that you have to take into consideration when it comes to making sure that, is this necessary or not necessary? Years ago, not so many years ago, but maybe about 10 years ago, I went in to see this doc, and he was a cardiologist. And because I push hard, and I'm always traveling, and I work out, and I do all those things, my wife said, will you please go get checked out? And I said, fine, I don't take any medications. And so here I am, and the guy is telling me that because of my age, right, and because basically that he needed to put me on an aspirin and a statin preventatively every day. And I looked at him and I said, Doc, there's studies that say that it actually causes more damage, particularly with somebody like me that doesn't have a problem. So you have to weigh it. It's not because of your age. Don't buy into that. Get a functional medicine physician who really understands it and really knows what's going on. There's some really good people out there. You come into our practice, and we're going to walk you through the puzzle and say, this is this, this is this. You have a choice to make. But we'll give you all the data, so you in turn can work with your doctor, if you have a family doctor or a physician you've been going to, and we'll show you what can be done, because there's a process of resolution. Just because you're of whatever age you're at doesn't mean you have to. In today's world, I'm seeing more and more young people being told that they have, a potential problem. And again, we've talked about that a little bit over a period of time. But for today's program, I want to talk about shoulder pain and how it's connected to the heart. Okay. So we said these nerves from the lower part of the neck go two places. They're going to go to the muscles of the shoulder. One of the areas we're talking about is the subscapularis muscle. And they're also going to go to the organ systems. And we're talking about the heart. We've also mentioned that the lung has muscles of the shoulder as well. But today we're talking about a muscle called the subscapularis muscle. And sometimes the fix for that is simply making sure that you have a potassium magnesium balance that's adequate, and you understand that if that lower part of your neck, your cervical spine, is out of position, it has to be functionally restored back to normal health. If that's the case, you can get your shoulder back. That frozen shoulder that you have starts working again. You start being able to reach back and nice and easily on either side, and you can do what you need to do. You can tuck your shirt in, you can ladies, you can snap your bras, you can do things of that nature. But you have to understand that there's a mechanism. It's not necessarily a disease process. It could be disease, dysfunction, disharmony. But once you understand where it's coming from, now it can be resolved. You have to understand the problem. You just don't throw drugs at it. The best thing that's in the process of happening, my opinion, is this shift in administration with Bob Kennedy, at the helm of trying to give you the right and choice of deciding what you're going to do with your own health and not just carte blanche. The other thing that I want to see happen, and I'm sidebarring right now, is simply this. All the advertising that you get for every damn drug on television, and it says, take this for that. If you have these symptoms, ask your doctor if this is right for you. Stuff kills you for the most part. These are biologicals, and they're things that suppress other actions within your body. When I grew up, when my grandchildren say, when the dinosaurs ruled the earth, that stuff didn't happen. It wasn't there. And you actually had to go to a doctor who really understood what was in front of them and was willing to walk through the process. And, years ago, my father went to this physician. He was a cardiologist, since we're talking about that. And he was having a few problems. And the guy said, listen, go back to how you were raised. My father was raised in the old country. Eat how you grew up, with the clean foods and the vegetables, and get out and walk, get out of the car. He said, throw those cigarettes away. You didn't do that when you were a kid. And we wonder why over the years we get in bad habits of dietary indiscretions and inactivity and polluting our bodies with certain things. All of those have a major effect. And one of the areas that's going to affect first, more than anything else, is the shoulder, because of the interrelationship, the intimacy of so many different organ systems, but in this case, the heart, right? So if you start feeling this achiness that doesn't resolve itself from position, if you start feeling this weakness that seems to never go away, if you start feeling this radiation down in your arm, and it doesn't have to be bad pain, it could just be, something that needs to really be ruled out. Let us know. We'll figure it out. We'll tell you what to do with it and get yourself squared away. But I want you to join us on the 19th. And I want you to understand that you can do so much to resolve these problems if you understand how they work. Brain, spinal cord. You have 31 pairs of nerves that come off the spinal cord. In the case, what we're talking about here is these nerves divide, and they go to the heart, and they go into the shoulder muscle, the subscapularis muscle. Now, you have other mechanisms too. The upper portion of your neck, if it's not in position the way it is, the vagus nerve, the 10th cranial nerve, goes to that organ. Now you have reflexive from the organ to the shoulder. It can go either way. It can go from the muscle to the organ, from the organ to the muscle, back and forth. And you have to distinguish, you have to figure out which one is which so you can get it squared away. It's important that you are the captain of your own ship, that health is a do-it-yourself program, that you understand and have the tools in front of you. And that's what my job is. My job is to give you information. And if you listen to the radio program, if you just got done listening to WMAL 105.9 FM, you hear me say these things, right? You have to be responsible for what goes on in your life. You didn't end up just by serendipitous, finger pointing that you're going to have the heart problem, you're going to have the intestinal tract problem. You did something to get there. So if you did something to get there and the body's fully able to resolve it, which it is, by the way, then it's up to you to learn as much as you possibly can to begin to resolve the condition from a basis of understanding basic foundational anatomy and physiology. That's what I do. That's what why I'm here. That's why I teach you these things, because I want you to get it. So what do we learn today? We learned that if your neck is a problem, you could have a shoulder problem because it's going to affect both your heart and what? And that subscapularis muscle. We learned that magnesium and potassium could be the culprits causing the heart to go into laxity or spasm. And we have to make sure that we modulate it and get enough of it in. We can, and I'm going to give you the next one, is that if there's not enough calcium in the system, and we need calcium, but we have to make sure it's transported properly. And I can't do it without enough magnesium and vitamin D. Patient came in the other day, and I asked questions I do everybody when it comes to vitamin D. Do you take vitamin D? And the guy says, yeah, I take some. I said, how much? And he says, well, my doctor told me that I should take any more than 1,000 milligrams or 1,000 units a day. And I said, oh, okay. And I said, what's your vitamin D level? And he said, well, the last time, and the guy told me, I think it was like 38, 39, something like that. And he said, my doctor said it was normal. I just looked at him and got really quiet. And I said, it's not normal. He said, what? I said, it's very low. Anything under 50 in functional medicine profile is considered insufficient. 32 or less is highly deficient. You're going to break bones. Immunologically, to have good strength, you need to get it up, way up to about 90, 95. That's where it belongs. And not just take a big dose, 50,000 units, once a week for a while until it starts rising. But it's not going to get it up to where you need to do. You need to take 10,000 units ongoing. And even if it hits 100, 105, functional medicine normals across the board now are over 100 and have been for a long time. I have a very dear friend who's a medical physician in Columbus, Ohio, and he does functional medicine, integrative care, and so forth. The guy's been at it for a long time. And he'll give people over 100,000 units of vitamin D every day ongoing for very specific conditions. And you say, what? That much? Oh my God, there's physicians that are listening to this right now that are probably having a stroke because of, I dare mention that. But the bottom line is that there's certain things that you need. Join us on the 19th. We're going to wrap this up for today. And I want you to follow me on an ongoing basis. Go to any of the social media sites and make sure that we let you know when we're doing something that's interesting for you. And remember, if you understand the process, you can fix anything. Remember, I'm here for you for one reason only. I love you all. Have a great day. Take care of yourself. Bye.